Welcome back to our third plenary session. This is the EHMA 2021 and it's a pleasure to be here with you for this last afternoon. My name is Alexandre Lourenço. I've been the Master of Ceremonies for these 3 days and I'm gladly going to introduce the new panel session. We'll have an amazing speakers, Kerry Thompson, Clayton Hamilton, Rosanna Tarricone, and it's really a pleasure to be moderating this panel session. This session is, as you know, dedicated to discuss digital transformation in healthcare, digital technology as a management tool, and mostly within this idea that digitalization of healthcare is essential to enable transforming the delivery of care and improving patient experience. The critical role of digitalization and the need to drive digital transformation of health systems have become even more evident during the COVID-19 pandemic, when digital technologies have been deployed in unprecedented ways to support the provision of essential health services. Beyond delivery of services, digital technologies are being used as management tools that impacts both the organization of work and staff well-being. This session will take something like 1 hour, and we have these amazing speakers that I introduced previously. You are welcome to use our chat box in your right, and you can continue tweeting and using LinkedIn with the hashtag EHMA 2021. But please use this time and use this opportunity to make your comments, remarks, questions to our amazing speakers. Let me introduce you firstly Dr. Kerry Thompson. She's the Deputy Head of Units eHealth, Wellbeing and Aging in Director General of our Communications, Networks, Content and Technology, well, mostly known as DG Connect of the European Commission. Kerry, the floor is yours. It's a pleasure to have you, and I'm sure that you are going to introduce the topic for us to start our discussion. Thank you so much.
Well, thank you very much, Alexandre, and good afternoon, everybody. It's a real pleasure to be joining you today. I hope it's sunny where you are. I'm sure it is, because it's Portugal. It's even sunny where I am in Luxembourg, which is lovely. So I've got some slides as well. I think they're just going to bring up. Indeed, I wanted to give you a little bit of an overview about what we're doing at the European level to support the use of digital tools, digital technologies in health and care systems. And first up, I think before going into the slides, I'd like to just give you the basic sort of framework we're working to, which is from 2008, and what we're trying to do in terms of digital transformation. This shows our 3 major objectives. Firstly, that we want to give citizens better access to their own health data, wherever they are in the EU, and working with member states to support them to make data available to their citizens, but also cross-border, should you find yourself in another country. Also to support the use of digital tools and services to really empower citizens. So this might be, for example, digital tools in relation to mHealth tools, for example, using your smartphone, all sorts of possibilities. And then the third objective is really around the data, the research side of things, the innovation side of things. So really creating better quality health data and more volume that we can bring together and can support innovation into tools and support the creation of these technologies and their use for diagnostics, prevention, from care and chronic disease follow-up and so forth. If you go to the next slide. We've just done I'm not sure how much of this you can see. We've just done a survey of member states representatives that sit on the eHealth network, which is a committee that we meet with regularly, now very regularly, thanks to COVID. And we surveyed them to understand where their systems are in relation to sort of preparedness for digital health technologies usage. You know, issues like how advanced they are in setting up their interoperability, use of interoperability technical specifications, what extent data is already being used inside their health and care systems and so forth. And so now this data doesn't show the countries, but it shows along one side all the ways in which data is being, extent to which data has been recorded and stored And so I think what you just have to point out is where it's a darkish blue towards the right-hand side, this means that the data is being recorded regularly for this topic and stored. Those at the top, you can see there's limited dark blue. These are all relate to M-Health information that's not being recorded and stored and used routinely. So clearly what we want to try and do is be shifting the quantity of blue, darkish blue, towards the right-hand side of the graph, and watch this grow over the coming years. And if you go to the next slide, the next slide is a follow-up slide then showing you actually how you, to what extent are you able to actually share, transfer different kinds of health data securely, and to what extent this is happening routinely in your health and care system. So that's the next step beyond actually digitizing and using. And here again, you can see we've got a certain, I'm afraid even I can't read what's on the left-hand side on the slide I can see. But what we want to see, of course, is more and more data being shared routinely for different kinds of functions across health and care. Because what we need to rely on, what we need for digital technologies, we need the data. We need the data to be used securely and for citizens to trust how the data is being used. If you can go to the next slide. So another framework that we work to is the data strategy framework from last year, and this is something that has got 4 pillars. So this is an overarching initiative. It's legislative. It's in terms of investment. It's political, and it's about trying to get data flow across the EU in all sectors, let alone health. But health, of course, is a key one, and certainly for this conversation. So one of the pillars is working on the governance. Making sure that we can all trust the way in which our data is being shared. We've got the GDPR, but that doesn't go far enough. Another aspect are what we're calling our enablers, or what we're calling big ticket items in the office. So potentially really big investments of large bits of infrastructure that's going to help data flow generally across border, but also support national. So this could be, for example, supercomputers or big bits of cloud infrastructure funded by a combination of European level and national level funds, for example. And we're also, another pillar of it is looking at the competences. We know that digital skills are very lacking in health and care systems, as well as amongst the population in terms of citizens being able to really exploit and use their health data and understand it. So we need to invest in that. And the 4th pillar is about rolling out common European data spaces, of which we have about 9 in total, but the one we're really talking about today is the health data space, and I'll talk about that in just a moment. So on the next slide, it's got a big picture, which I won't go into all the detail, but it gives you an overview, particularly if you can take away the slides. It gives you an overview of the different legislative actions that are happening now, recently or ongoing, and they're all building on the Open Data Directive of 2018, and it's about creating a governance framework then for the use and the reuse and sharing of data. So, for example, the top one, the Data Governance Act, this was a proposal that came out from the Commission in December last year, and well, they're all horizontal actions, but they all also will touch upon health in some way. So in the Data Governance Act, for example, Chapter 2 refers to the reuse of sensitive health data being held by public administration. So this would be hospitals, health and care providers. Another part of it would be, and incidentally, part of it would be trying to set up, it leaves space for member states, but it will ask member states to set up an entity at national level that would have a role to coordinate and set the governance framework rules and monitor how health data is being used. And you can look for inspiration there at certain national entities such as FinData and the French Health Hub for an idea of what we're trying to create. And when it comes to a health data space, these entities then may also have a role in transferring in how data is accessible across borders. Another part of that, incidentally, is Chapter 4. There's the possibility to create data altruism entities. So these could be set up heavily regulated entities. So people, if they wish, could donate or could give their data to the entity, and then there could be a another source of citizens' data beyond what's coming out of public administration. So this just gives you an overview of what's coming up. And then if you go to the next slide, I can talk a bit about the European Health Data Space. So obviously this is the data, this is something you may have heard of. There's various parts of this concept. It's being very much one of the priorities of the Commission now is to really develop health data in the European Union, both to support member states for national health data sharing, but also cross-border. And part of that is legislative. So part of that is seeing what else needs to be done from a sensitive health data perspective on top of the horizontal data initiatives to really ensure that we have the right rules in place. Another part is about ensuring that what data we have decent quality of data. And I think one aspect of this is the technical standards for sharing them, and do these exist? Have they been taken up? Are they being used routinely in health and care centres across the EU? So part of this on our side was the work to create an electronic health record exchange format, which sets down where we are with currently consensus technical specifications. And we're doing some work now to really develop the next generation of technical specifications, which we'll hope will be available next year. And then we'll be encouraging member states to take these up so we can see different kinds of data being shared. Of course, there's also the issue around the infrastructure, and there's a pilot project kicking off this year with a number of projects looking at, well, how can we develop the right infrastructure to see health data securely shared for secondary purposes, for primary purposes, so just for clinical usage, and for the citizens' use, we already have an infrastructure that still needs to be further expanded called My Health at EU. But we need to also work out how to develop this for the secondary usage. And of course, there's the issue of capacity building and skills as well, where we hope to invest resources under many of the different pockets of funding that I'll talk about at the end of the presentation, one of which is the Resilience and Recovery Fund, for example. There'll be funds there. If you go to the next slide, another thing that we're doing is setting a very ambitious set of targets for really developing the European Union, bringing digital benefits to citizens in a very visible way. And on the health side, we have a target, it's just in the bottom right hand, digitalization of public services. And we want to set the target that 100% of citizens will have access to their medical records by 2030. And we know from the survey that we've just done that this is work in progress, that 16 member states have currently got a mechanism in place to share for citizens to securely access their health data, and that another 6 have developed pilots. And we intend to work with the member states to encourage the rest to develop something similar. And where some of the issues that these countries face, for example, is there appropriate digital identity tools that they can use? These are sort of fundamentals really for ensuring that citizens can feel safe using the data, or health and care professionals can reliably access data in a secure way as well in their health and care system. So if you go to the next slide, I will just tell you a bit about something else that we've published, which is a digital identity for all Europeans. So this is a very recent proposal just coming out 2 months ago, with the idea to encourage the uptake of a digital identity. So it proposes a tool that can be used across the EU by citizens and by businesses for any kind of purpose, but health is one of those. We hope this will be a tool, for example, that countries looking then to put in place portals or other kinds of mechanisms for citizen access to their data will be able to use this if they do not as a mechanism. And of course, what we've seen from the pandemic is the way in which the COVID certificates have been widely taken up, and these have relied indeed on security, on ways to authenticate the information, and we hope that this may lead people to a certain degree of comfort that this has worked and this is secure, and then this can have a wider usage in other parts of the health and care system. If you want to go to the next slide. So then lastly, to let you know about some of the funding mechanisms, we've got an awful lot of resources going into this area over the next 5 or 6 years. So firstly, of course, there's the Recovery and Resilience Fund, which is a 670 billion pot of which 20% is reserved for digital. So if you imagine that 10% of that 20% is for health, then you're talking 2% of the 670 billion, and we're around 15 billion investment in health. And this is something that member states are very much directing how to use. We've also got a new program called EU for Health in the region of about 5 or so billion, which will have a number of resources for strengthening health and care systems, preparing them for digital transformation. There'll be support there to help build capacity in health and care systems and health centres, whether it's for skills, whether it's for actually digitising the health data, whether it's for developing the infrastructure at local level. There'll be resources there. We've also got the Digital Europe programme, which is one that we in Connect particularly develop, and this is a 7.5 billion programme aimed at particularly deployment. Horizon, I guess you're very familiar with, that's the research programme, but this Digital Europe programme, we really want to deploy infrastructures. So one of the things we'd be deploying there is work to actually develop data, build the infrastructure to support the development of data, health data, for example, in the area of genomics and in the area of cancer images, as well as support for capacity building in cybersecurity, developing the cybersecurity industry for a start, in order that it can then meet the challenge that will be coming out of health and care systems in the years to come. But also high performance computing, any other sort of data sharing structures that will be needed. And then there are many other programs, so I won't talk about them all. Of course, this is European money. There'll also be national money. So I think what I hope will be visible to you working in health and care centres across the EU will be that this money will be visible to you coming over the next few years. But that was a quick run through of kind of European level frameworks. Obviously, we're not running hospitals or complex organisations like that here, so we rely on you for this kind of feedback. But just to let you know what's happening at the European level, and I hope that it will be, some of these elements will be very visible to you over the coming years. Thank you.
Much, Kerry. Thank you so much for this introductory keynote. I'm sure that all the participants and the delegates are thrilled to have this news from you. Let me introduce you our panelist, Mr. Clayton Hamilton. He is coordinator of the Digital Health Flagship within the Division of Country Health Policies and Systems at WHO Europe. And we will have also Professor Rosanna Taricone. She's the Associate Dean at SDA Bocconi School of Management. You may know her also because she's a long-time partner of EHMA, and probably we have been following also the webinars that we have been organizing jointly with Bocconi School of Management. I will start with Clayton to make your opening comments.
Thank you much. Good afternoon, colleagues. It's wonderful to be here. And I'd like to offer sincere thanks to the European Health Management Association for the opportunity to be able to present to you this afternoon. So I think we've heard some very, very interesting and very strategic inputs from Kerry, highlighting the fact that the European Commission has a very strong commitment to digital health and has had so for many years. What I wanted to do this afternoon was just to reflect briefly upon you as to what WHO is also doing in this space, how much the agenda has actually grown due to COVID, how digital technologies have been used both for health management, clinical care and public health during the pandemic, and then perhaps just touch briefly upon what we see that the future might actually look like as we move with further digital transformation in health systems across Europe. So firstly, I just want to introduce briefly to you the Empowerment Through Digital Health in the European Region initiative. This is one of 4 key priorities from the regional director of WHO, who made the opening presentation in the conference this week. And his message of not just building back better from the pandemic, but building back fairer, I think is one that has resonated throughout the 3 days of the conference here. What we want to do is to explain to you how we see digital health as forming part of that contribution following up from COVID, and how really the political priority of digital health has increased even prior to, but certainly been accelerated by the pandemic. So firstly, this initiative is relatively new, and it really reflects the strategic engagement of the 53 member states of the WHO European region in delivering digital health. It's moved from something that was very much on the periphery to very much the strategic front of center of their daily work. So the idea of this initiative is to provide policy guidance and technical advice and expertise on the safety, efficacy, and of digital health solutions, but very much taking the public health principles of equity, gender, equality, and human rights into the digital space. And this can be quite difficult to do, and there's very much often a disconnect between the developer community and the public health community in this area. So really this initiative is trying very much to fill that gap and then be able to provide appropriate support of a technical nature to countries. And it's drawing upon the WHO Global Digital Health Strategy, which was approved of the World Health Assembly late last year. So there are three major strategic objectives that are helping to bring digitalization of health systems forward. Firstly, aligning digital technologies to the notion of achieving universal health coverage. And this is really the entire package of factors that many of which Kerry mentioned, that we have to work together in order to increase the digital capabilities of countries. So that's everything from data to health workforce capacity strengthening to enterprise architectures, all of the factors that are essentially involved in creating digital health success. The second is really, how do we internalize the lessons we've learned from COVID in order to improve protection against health emergencies? And again, these can come in many different shapes and forms, but it's really about increasing health security across the European region through the adoption of data and digital technologies. And then finally, really looking to how we can adopt and use digital technologies to move away from a more reactive paradigm of healthcare to a more preventative one. And again, this is often delivering on the promise that digital technologies have made for so long. But when we see also the nexus of digital, of genomics data and of big data and high capacity computing, then we're starting to see that we really are beginning to look to solutions that are delivering on that promise. So if we just focus for a second on the COVID-19 pandemic, what we did at the very beginning, we saw a lot of countries rapidly implement their digital technologies in a number of different contexts. So the presentation in front of you really just tries to map this out and group them in with a little bit more structure to try and give the perspective that it wasn't just a blanket application of digital technologies, but in fact, there were many different pockets and many different entry points for which digital technologies were employed. Mostly the media was focusing on the diagnostics and diagnosis capabilities of digital technologies, but really right across the spectrum of health management, all the way from awareness and prevention across to efforts for recovery and reestablishment, digital health had a very large footprint. Now, again, there were also notable cases where it failed to deliver on the promise, and notably, I think some of the promise of artificial intelligence really isn't mature enough yet to achieve what we hope that it will one day. But there was certainly, in terms of managing increases in surge protection in hospital settings, through simulation tools, through being able to map and source inventory for healthcare professionals, digital had a much bigger role than we perhaps had anticipated before the pandemic. So again, many different applications across the spectrum. So what did we learn from all of this? Well, again, drawing upon from some of the key architectures, which Kerry, I think, presented extremely well, what we saw in WHO was very much from the public health perspective that not everyone was able to access the digital technologies and the benefits that they were offering equitably. And in particular, vulnerable groups were much less likely to benefit from digital technologies. And in fact, this in a way hit them in two ways. So we found that not only were they found access to services increasingly difficult prior to the pandemic, but the inability to do so digitally actually made it doubly hard for them. Secondly, we very much noticed that, as Kerry mentioned also, digital competencies of the health workforce were and are still lacking, and a lot more systematic approaches need to be adopted in order to improve that. We also saw that there was a need for rethinking the privacy of individuals and personal health data, and really in hammering home the fact that we should not relinquish the standards and legislation on personal data protection due to health crisis and pandemic, or it really is a difficult position to recover from at a later stage. We really saw a huge acceleration in removing the barriers for COVID-19 that COVID-19 did for digital technologies, but still some of the inertia still persists. So we have very much to work in order to continue to do that. And then really just finally to say that there was also, and it continues also to be, a lot of false and misleading information propagated in digital environments. So the whole concept of an infodemic following the epidemic was very much something that emerged during the pandemic, and something for which the science around how to combat that type of information is really still developing, and we're starting to develop a lot of tools in that WHO to do so. If we look forward to the future, there are a number of key priorities where we see digital health being applied. The first one is very much strengthening primary healthcare. So this again is a mainstay of WHO's initiative, the European Programme of Work in the next 4 to 5 years. But we also again see that strengthening digital skills of the health workforce is another key area of focus. And we're partnering together not only with the European Commission, but also with AMI and other educational institutions in Europe to make sure that we tackle both pre-service and in-service education needs. Looking also at digital mental health services, we can see that not only for the health workforce, but for the general public, this is a huge burden of health, and we need to look at evidence behind where digital health can actually make an impact there. Then finally, improved data governance is an area which also I think unilaterally international organizations agree on. We saw really a need for health data to be better employed throughout the pandemic, and one which I think we're going to, based upon the conference over the last 3 days, really now begin to articulate new methods and new relationships in order to do so. So thank you very much. I really think that hopefully leads on very much and segues from Kerry's presentation. But again, look forward to questions following up after that. Thank you very much.
Thank you so much, Clayton. I also encourage our audience to put the questions on the chat box, that we will have the opportunity to use them during our panel discussion. Let me go to Professor Rosana Tarricone and ask her also to make her initial remarks. Thank you so much, Rosana, for being with us. It's always a pleasure. You are a long-time friend of EHMA. The floor is yours.
Many thanks, Alexandre, and that's a very great opportunity, especially to be part of such a distinguished panel with Kerry and Clayton. I would like to bring in the discussion also another perspective concerning digital health, and perhaps more particularly on mobile health applications. We have seen how much commitment and how much effort international organizations such as WHO and of course the European Union and European Commission are putting into digitalizing health. Why? Because we all know that there is a big promise that the digitalization can provide us all in terms of better health outcomes, and also a better efficiency in delivering healthcare services. And here it comes my perspective that perhaps tries to bridge the policy perspective with also the management perspective of healthcare organizations. And what I'm trying to say as a premise is that although there is such a big promise by digital health, and particularly, I'm thinking of medical apps. At the same time, we haven't seen so far, a comprehensive assessment system of those new technologies delivering healthcare services. Which means that the current situation is in a way a bit paradoxically, because we have a much